Following is a sponsored segment.
Well, most of us know the benefits of our children receiving quality orthodontic care, but do you know just how early your child should be screened for potential orthodontic issues? Today, I have with me Dr. Brad Hudson of Hudson Orthodontics to tell us more about this early orthodontic screening that's taking place. I'm a kid that had braces when I didn't take care of my braces, but I did it, and I'm glad we did, but I guess that question for parents is, how do I know when I'm supposed to take them in and get started?
Well, kid, it's a common question, and this question comes up all the time. So essentially, we've started to recommend, the American Association of Orthodontists is recommending a screening at age 7.
Okay.
Okay? A lot of parents don't know that. A lot of parents are taking their kids in, they're getting their cleanings and they're getting their checkups with their dentist.
Right.
But one thing that's real key is when your child hits the age of 7, to get screened by an orthodontist, because there's some important changes that are happening around that age.
So what made them come up with that magic number of 7 and not 5?
Right, exactly. So at age 5, most children have all their baby teeth and no permanent teeth. But by age 7, kids are starting to get their permanent teeth, and their jaw growth development pattern is being set.
Okay.
So at age 7, we can start to see if there's a problem with the jaw growth pattern.
So let's talk about some of the problems that you can detect at 7. So the jaw growth and what else?
Well, essentially what we're looking for at age 7, we want to know 2 things. One, is there going to be enough room for a child's permanent teeth to come in successfully? Okay. Secondly, we want to see, are the jaws lining up, or is one jaw forward or behind the other? Because if that's the case, we need to intervene early to avoid more invasive treatment in the future, such as permanent tooth extractions or even jaw surgery.
I was one of those kids. I didn't have enough room, so they had to take 2 teeth out.
Exactly, exactly.
So what are the benefits of detecting at an early age?
Okay, what we typically would do if there's a situation where there's a problem that's detected early, what we typically will do is recommend some very specific treatments. It was usually going to be a short-term treatment, less than a year, and again, the focus is going to be establishing enough space for the permanent teeth and establishing a favorable jaw growth pattern. Okay? Once that's accomplished, we can stop that early phase of treatment and then wait for a child's permanent teeth to come in.
Do parents that are maybe watching right now, do they need a referral from their dentist? How does that work?
Right, kid, that's a very common question, and one where I think there's some misinformation out there. There's no referral required. Okay, oftentimes a child's dentist will make a referral around age 7 or 8, but if a parent is concerned, they see something that they don't like, or they just know that their child's turned 7, we do this without a referral required. We do this for free, and it's a great service for the community and for the children to be able to have that out there.
So let's talk about the programs that you have going for the younger kids at your office.
Yes. Okay, so kid, what we've done, kids that age, they like things to be fun, and I don't blame them, because I do too. So what we've done is we've created a kids club. It's geared towards children in that age 7 to 11 range, and we call it the Little Surfer Smiles. Okay, that kind of draws on some of my hobbies in water sports and that sort of thing, but it also is just something fun for kids. What we do at that age, we do a free or a complimentary screening. We do a full exam. If x-rays are required, we do that, and that also is complimentary. And at that point, we go ahead and look and see, is there enough room for the teeth? Are the jaw growth patterns favorable? And in addition to that, we offer some fun prizes. Kids can be enrolled in our Kids Club program, which they can get fun prizes and rewards whenever they come in for their appointments.
Nice.
Yeah.
So it's about making it a fun experience for them too, because sometimes that can be tough.
Absolutely. Absolutely.
All right, let's go to real quickly give out the website if people want to get more information.
Yes, absolutely, kid. We can be found on the web at bhorthodontics.com, and there's a lot of great information on our website. Very, very good information for parents and for the community. And we'd love to make sure that people know that that's always going to be complimentary at our office.
That's great. So you got a 7-year-old, again, complimentary. Now's the time to maybe think about bringing them in and at least getting it checked out and make sure things are on the right track. And if they are, then that's all good. If they're not, then there's things that we can put in place.
Exactly.
Excellent.
Exactly.
Thank you so much, Doctor. Good to see you.
Thank you.
And we're going to have more of Let's Talk Live right after the break.
The proceedings